What is up, guys? Dr. Drew here, back on the channel. We're at Hawkeye Chiropractic in Arlington Heights. If you guys are watching this video and you haven't subscribed, make sure you do. I know you guys watch these videos because we have about 20 to 30,000 views on a couple of these videos. So it really helps us if you subscribe, hit that notification, really appreciate it. So today I'm here with Mark. Okay, Mark's one of our best patients of all. He's an HVAC technician, so he's constantly lifting, bending, and moving consistently. I mean, how many hours did you put in this week?
Right now I put in 36 hours.
So 36 hours, and today is Wednesday. So again, he's working 5 to 6 days a week. So easily you're putting in at least 60 hours for sure.
Yes.
I'm guaranteed. So a lot of stress on his body. And how long you been doing this?
I've been doing this for the last 2 years now.
Yeah, long time.
Yes.
So Mark, first thing is why did you seek chiropractic care? You know, what made you, go into chiropractic care as far as like what a treatment would be?
My back was hurting me a lot when I was going into attics and crawl spaces. When I was sitting down for too long of a period, my back was hurting me. I saw you guys on Facebook doing a promotion, so I called and set up an appointment, and then I loved it here ever since. Tell
the viewers a little bit about why you love it. Some things that you've noticed compared to like other offices or other things that we do.
They make you feel welcome. They actually know you by your name. They don't just say, "Oh, how are you today?" Every single person who comes in, you guys actually say, "Hi, Mark." How you just, I don't know, like you guys remember every single person, which that to me is just crazy, because a lot of people, a lot of businesses, that they don't do that. They don't take time to learn their names. They just say, "Okay, let's crack your back," and you get out. No, you're actually asking about the family, and if I tell you something and 2 weeks later you actually bring it back up. So it's like, it's not going one ear out the other. You're actually like listening, and it feels like we're all one big family here.
Thanks, Mark, appreciate it. Yeah,
yes.
That's just a testament to the staff and everyone here, just the culture that we bring.
Yes.
It's not just with Mark, but everybody, like we've said multiple times on the channel, not a big business, we're a small business, but we treat everyone like I would want my kids or my wife to be treated. So it's super important that everyone's treated with respect, feels comfortable, everyone gets the best care, because that's how everyone's going to benefit, kind of go from there. So currently Mark has been in our office for a few things. First originally came with lower back pain, had a shoulder injury at work. The pain went away, it's kind of come back, especially with a lot of hours that he's been working. So what we're going to do today is we're just going to go over a couple things that we do with his shoulder, some soft tissue stuff, some range of motion things. Once we do that, we'll go through getting his lower back, his thoracic spine, and neck adjusted as well. But again, guys, if you're watching this video, please hit the like button, subscribe. If you have any comments or questions too, we're always happy to answer, but make sure you guys take a look at us, okay? So Mark, just take a seat for me right here, face there. So first thing I'm gonna do, I just want you to just bring your arm all the way up to the top of your head and tell me if you got any discomfort and where.
When I go a little bit higher, right here.
And where would you, go ahead, point to it for me.
It hurts like right there.
Okay, so we're having pain at the back of the shoulder here? Okay,
yes.
Go ahead, relax. I want you to just all the way across your body now. Good. Any discomfort, and if so, where? Same position?
Yep.
Okay, now I want you to bring that arm underneath your back and then try to bring it all the way up.
Oh, I can't.
Where's the discomfort? Same thing?
Same thing.
Okay, so we can see a huge decrease in the range of motion here. Go ahead, relax. So one of the reasons why typically, and you guys could try this at home, just bring that arm underneath and kind of go from there. Typically, a lot of guys are very anterior dominant. So what that means is anterior is front, posterior is back. So when we're anterior dominant, that means that again, our shoulders are rotated forwards, okay? And typically that's because one, we're texting, we're driving, we're texting, we're on our laptops, computer, we're constantly focused on technology. And so what that does is it actually rotates the shoulders forward, okay, decreases that range of motion for the shoulder. So when Mark's doing something such as bending and moving now, it's going to be having a decreased range of motion, which will ultimately lead to essentially stress on the muscles, ligaments, and tendons, as well as the nerves coming through that nerve root, okay? So a couple things that we're going to do today to kind of unlock that tissue and then open up this. First thing is we're going to work on the shoulder. Once we do that, we're going to work on his chest, just opening up those pec major and minor. So first thing I want you to do, Mark, you're going to take your hand like this, thumbs up, and I want you to put your thumb like this, up just straight ahead. And so what I'm going to do is I'm going to find that pain point. Once I find that pain point, I'm going to have Mark just bring his arm all the way across. And then once he gets there, he's going to stop, okay? We're going to reset, do that multiple times. And so what this does is I'm essentially finding that trigger point, that point in there specifically where he's having that discomfort. We're going to roll over it, stretch out that tissue, and then we'll work on the front side too, okay? So nice and easy here, Mark. Go ahead, just bring that shoulder all the way across. Good, as far as you can. Good, go ahead, relax. Now, if you're having trouble getting it here, what I want you to do is take that right arm, bring it underneath here, and just pull that shoulder across, okay? So let's just reset. So again, we're gonna find it, pinpoint that area, go ahead. Good, reset. Good, 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 keep going. Go, 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 go. Good. Reset. Make sure you bring that right arm underneath. Yeah, there you go. Right there. Good. Reset. Good. A couple more passes here. Good. Just breathe. Good. Yep. Good. So what I want you to do now, just bring this arm all the way across and then hold it like you're doing a tricep stretch. Okay. So what I'm going to do, I'm just going to sit here next to Mark. So what we want to do is just hit under here, okay? A lot of times this muscle and a few other muscles in the shoulder blade, okay? They call them the sit muscles. You guys can look that up. And then the teres minor in here, they get super tight. So we're just going to pin it nice and easy. Hold it there. This is just going to loosen that up, so he's going to have a lot more range of motion in that shoulder too. And then again, too, these traps get super tight with all the tension from looking down. So you have a lot of components going into the shoulder here. And so after a long days of work, these guys are fatigued. They're just tired, man. This is a lot of stress on the body. And it's not just HVAC guys. It's our plumbers, construction guys, our laborers, flooring guys, roofers, anyone that's using their body all day, okay? We see a lot of guys, ComEd, a lot of linemen, things like that. So this is a common thing that we see all the time consistently, okay? So what I'm gonna have you do now, Mark, just lay on your back for me, okay? So what we wanna do now, okay, is we just wanna open up this chest. So I'm gonna have you take this arm out just like this, just let the arm kind of hang. And so what we wanna do is I just wanna warm up this chest here. And so we're gonna just get in here nice and easy. Yeah, there we go. Let me know if that pressure is too much.
Oh, it feels amazing.
Yeah, so same thing, open up this chest. If you don't have one of these hypervolts, guys, you can go ahead and just go through a door frame and just keep that elbow and that forearm on the inside of the door and just push that chest through. But what this really does is just opens up that anterior chain, just unlocks it. Nice and steady here, good. And again, you guys, you got to do this consistently. It's all about reps. If you just do it once a week, you're not going to see the result. Especially if you're working 8 to 12 hours a day. Again, you got to be consistent. You got to do this, and then over time, you don't have to do it as much. But if you don't, this is what happens, and it leads to injuries and stuff like that, which is what we don't want. Okay? Go ahead, relax. I'm gonna have you sit up. What I'm going to do is adjust the shoulder now. Okay? So I'm going to reach around. I'm going to grab his elbow. Nice and easy. Same thing. You're not going to hear this massive big pop and crack. Good. Nice and easy. Just relax. Beautiful. There we go. How was that?
Amazing.
Okay. All right. So now we're going to have you go ahead and lay chest down for me. And we're going to go through your spinal adjustment. So same thing. I'm going to check the hips here. Just like this. Again, you're going to see, if you take a look here, that this right leg is about a ½ inch shorter. Okay. Same thing, guys. Look at the bottom of these soles, see what's going on. I'm gonna bring them up, check to see. So it's a little bit off, maybe 1/4 inch, but again, that's gonna give me a positive sign. I just got what we call a PI on this side here. Good, just feel the top of the hips. Again, which hip's higher, Mark?
This one.
Yep, so that's gonna confirm as well that this right hip shifted, which is gonna show that leg length difference here. So again, first thing is, we're gonna go ahead, piece is gonna come up, push down. We're gonna go clockwise, bring this pelvis this way, unlock it nice and easily, go from there. We're gonna adjust the thoracic spine, so you're gonna hear that pop and cracking again. We want nice, good mobility. Deep breath in, all the way out. Perfect, good. Same thing here, good. Perfect, okay. What I'm gonna have you do, Mark, lay on your left side. Gonna get this pelvis adjusted, make sure that the lumbar spine's also in place here. Nice and easy. Good. Beautiful, good. Other side. Good, same thing, and then we'll get your neck adjusted. Okay. Perfect, good. We're gonna adjust Mark's neck. Just relax your head on me. Good. So what I'm doing here, guys, I'm just palpating side by side. I'm checking to see where those vertebral bodies are at, consistently making that we're putting it back. So can you feel the difference on this right side, Mark?
Yes.
Compared to the left?
Yes.
Okay. See how when we drop down here, you can feel that? So these mastoid processes, when you fall off, you're gonna have C1 and then C2, C3, C4. So we got a body right here on the side. What we're gonna do is adjust this nice and easy. Just drop your right shoulder. Perfect, good. Take a look at this side. Good. Relax your left. Woo! There we go, big dog. Awesome. How'd that feel?
Amazing.
Good. So what I want you to do, okay, remember, open up this chest. You can use a lacrosse ball on the wall, door frame, if you don't have anything like that or any help or any of those hypervolts. And then again, hydrate that tissue, especially with working so much. Make sure you hydrate, okay? Appreciate you being on the channel. Thanks for trusting us with your health, and we'll see you guys in the next video.
Yes.